Hello, my name is Julia Casey and I'm the clinical educator for Coverdale Infusion Clinics. This video will review how to do a Nabs blood test. Open up your kit and lay out your supplies. Check your blood tube to make sure it isn't expired. Expired tubes will be discarded by the lab and not tested. If your blood tube is expired, you can use a non-expired tube from another Nabs kit or from the clinic lab supply stock as long as it's the same type and size. If you do swap in another tube, make sure to cross out the expiry date on the outside of the Nabs kit to avoid confusion at the lab. Apply the label to the blood tube and the cryo vials. Make sure the arrows are pointing towards the top of the tube. Apply the label to the requisition. Draw the blood sample before the infusion starts, as Tisabri may impact the test results. Perform skin antisepsis as per SIVA recommendations. Draw blood off the IV line or using a butterfly set, and then gently invert the tube 5 to 10 times. Let the tube stand for 30 to 45 minutes to allow it to clot. This will help it separate properly when centrifuged. Place the tube in the centrifuge and ensure a proper size counterbalance is placed on the opposite side of the centrifuge. For the 5 ml gold top used for Nabs, a 5 ml gold top with saline or sterile water inside is a good counterbalance. Close and secure the lid of the centrifuge and set it to the highest setting for 10 to 15 minutes. Make sure the gold top tube is well separated. There should be no red tint or streaks in the top layer of the separated specimen. The serum should be clear yellow. Gently remove the gold top rubber stopper. Be careful not to touch the polymer barrier between the serum and the cells because this will contaminate the serum. Pipette out the serum into the cryo vials and seal them. Discard the gold top tube and pipette. Complete the requisition. If the NAB sample will be refrigerated before shipping, write that on the requisition. Place the absorbent pad and labeled cryo vials into the biohazard bag. Remove as much air as possible from the bag and seal it up. Add in the requisition. Depending on the time of the year, you will either use a gel pack in the colder months or an ice pack in the warmer months. This chart can also be found in the Nabs blood test SOP in the file library. Fill the gel pack bag with cool tap water to the fill line, about 250 ml, and zip it closed, removing as much free air as possible. Squeeze the gel pack bag gently to allow the contents to mix with the water. Lay the entire gel pack on a flat surface and spread it evenly throughout the pack. Place the biohazard bag with the cryo vials in the rear pouch of the gel pack. Pack it in the sample shipping box. If you don't have a gel pack, you can also use a thawed, room temp ice pack instead. Roll up the cryo vials in bubble wrap and put it in the box. Add a frozen ice pack. Complete the FedEx waybill. See the Nabs blood test SOP for more information on how to properly complete the waybills. Keep the sender's copy for your patient's chart. Lay the FedEx clinical pack envelope on a flat surface. Remove the paper backing from the FedEx waybill holder and stick it to the FedEx pack in the marked area. Place the waybill inside. In the top right-hand corner, attach the to and from site labels.